the second communique is by Mehmet Onur, the liability of Hajj in cases of mental health problems. Mehmet Onur is an academician at Mustafa Kemal University, Faculty of Theology.
And please unmute yourself. Hello. Selamun Aleyküm. Aleyküm selam. Bismillahirrahmanirrahim. In this proceeding, I will talk about an individual who is facing a mental health problem, and we are going to talk about its impacts on the obligation. So if someone becomes mentally ill, then depending on the capacity to comprehend the consequences of behavior, to what degree that individual will be held responsible for the Hajj obligation. In fact, there's a common understanding that the Hajj may not be an obligation for certain illnesses. And here we'll examine certain diseases such as Alzheimer's disease and other dementia diseases, schizophrenia and epilepsy, and examine the effects of the diseases on performing the pilgrimage. We will talk about the mental health. If the mental health was there, but during the Hajj, if the mental health is lost, then can someone substitute that person? We're going to look for answers to all these questions. In fact, according to Islamic law, if any Muslim has the power in a certain period of time, the Muslims, the believers, are obliged to the Hajj, and that ibadah includes certain elements like Arafat, and that definition is used to define this set of practices. And whoever is obliged for Hajj is in fact mentioned in the 19th verse of Ali Imran. It says that if you go to Abraham's place, you will be safe. And if you have the power, visit that house. And in fact, that is a right that God has on the human. Then, if the individual is physically healthy, if it has the financial means, and if that person is not prevented from traveling, if that person is free, is mentally healthy, and if that person has been over the puberty and adolescence, then that person will be responsible for Hajj. In fact, full competence is required to fulfill. And competence means that the necessary requirements can be fulfilled by this person. And in terms of the law of obligations, that person should be capable of borrowing and also lending money and assets. So it's about also the legal rights and competences. That person should be eligible for the rights and tasks and obligations. In fact, each individual has the hijab competence. It's a license that you get with birth. So in mother's womb, it is incomplete, but with the birth, in fact, it becomes a complete hijab competence. The competence of one person can be damaged, can be decreased, but it is related to not hijab but eda, fulfillment. So eda is about action and fulfillment. So that action of this person should end up in a legally legitimate way, and it is related to eda competence. Once the human's competence becomes complete, then if it is destroyed, if it is eliminated, if it is decreased, It is one case. But if there are some other cases which affect the competence, these are called the competence defects. So competence defects can totally demolish the competence of an individual. Cünün, ate, ima, nev, harazmet, şükür are those kinds of problems. So mental health and its effect on Hajj as a competence defect or failure. In conventional literature, so mental health diseases and their impact on Hajj are considered, especially in the context of Cünün and Ate, so which means mental illness and dementia. The individual can speak and act in an illogical way, and this is defined as a mental illness. It is Cünün. So the following hadith of Muhammad, Prophet Muhammad, in fact, relieves the responsibility of three people. So children up to puberty, those who are asleep, and mentally ill until they are treated. So, in fact, this hadith brings some rule. There is no conflict of opinion on this. But as regards legal relations, there is some conflict of opinion regarding Cünün, the mental illness. If one individual was not mentally healthy before the puberty, then this is Cünün asli, that is essential mental illness. But if Cünün started after adolescence, it is Cünün arzi, incidental mental illness. So for this for the first category, the individual is not accountable for the ibadah. Even if all other conditions are fulfilled, the Hajj obligation is not applicable for that individual. Before the individual gets Cünün arızı, in order for the Hajj to be fard, in addition to mental health, if the other conditions are also fulfilled, then that person becomes an obligee for the Hajj fard. If there's a failure in the completion of this obligation, and if that person is get caught by Cünün arızı, since the mental health was lost after the imposure of the obligation, it means that the obligation will not be inapplicable. However, that individual is not able to fulfill this obligation. The guardian or the custodian of that person can perform the Hajj, or at least they can find someone and then in consideration that other person to be found can fulfill this obligation for the person who is no more mentally competent. Depending on the continuity of the state of mental illness, it is also possible to have some considerations. If it is comprehensive and complete Cünün, it is Cünün mutkub. If it is incomplete Cünün, it is gayr mutkub Cünün, incomplete Cünün. In the civil law Mecelle, the relevant definitions are also provided. There is one more consideration to make. The mental illness of the individual can be considered Cünün mutlub only if the continuous or the continuity can be explained. So there are many opinions about the status of the illness. For example, Hanefi mazhab envisages a period of 1 year, 1 day more than 1 year. However, the acceptable fatwa sermon says that it should be 1 month over 1 year. And also, it can be understood as certain parts of the year, certain regular periods of the year for the Cünün makab. Now let me speak about ATE. ATE, in fact, deprives one person of the power of comprehension. It's dementia. So that person either behaves as a sane person or as an insane person, and you will see some awkwardness in the speech of that person. So in the fiqh jurisprudence, can find a definition of dementia, but this ATE is different than junun. And some contemporary interpreters, in fact, define ATE as the lowest level of junun. That is why any person subject to ATE is considered as an incompetent child. Amazed child. Dementia is categorized into two. In fact, in the previous lecture, you heard about the incompetent child. And gayrimeyiz, in fact, will not be an oblige. If there is dementia at the level of junun, then the comprehension will be affected and lost. It means that there will be no obligation at all. However, for the meyiz childhood, if the dementia is at that level, as you heard from the previous professor, then the obligation of a Hajj is accepted to be applicable by scholars and as inapplicable by some other scholars. On the other hand, most of the Islam lawyers say that only people with dementia can be meyiz, and if the power of competence of judgment is lost, they are no more different than a mentally sick patient. So it's in fact the second one, so it's more these principles of Islam, the depending of this power of judgment one should design. So also we can talk about the contemporary literature. In fact, there are many different names for all these diseases. For example, there is a collective category that is called dementia diseases, and clinically dementia can be categorized as mild, mid, and advanced dementia. In the mild level, the patients will forget, you will have difficulty in remembering the places where they left their things, and also they will need some lists in order to remember certain items, and they can forget the names of the people they get to know newly. And the short memory will be lost. And some trivialities of the day can be lost. Emotionally important things can be partially remembered. Also for the items of forgetfulness, lists can be prepared, and some hints and clues can be helpful, and the speech will be less fluent, especially when the discussion is about complicated topics. It may be difficult to find the words, and if the co-workers are supporting the patient, then and also if the work is not cognitively challenging the individual very much, that individual can continue working. If they can do the household chores, they can also drive, and they can pay their bills, and they can get engaged in social activities, and complicated social events and complying with the dressing code can be difficult. In the mid-level, there will be more degeneration of the memory, and faces will be forgotten, starting from the people who are away, and sometimes the clues and hints will not work, and the orientation, the spatial orientation will be lost, misperception, hallucinations will be increased. There will be delirium, and also even in the familiar environments, people start getting lost, and there will be some repetitive behavior. And if it gets more severe, you will see even a worse clinical picture, and people will need the help of others. Your last 1 minute, Professor. Mehmet. Okay, I'll try to wrap up. Then let me go into the conclusion part. So, according to the medical science, there are many mental illnesses such as Alzheimer's, epilepsy, melancholy, hysteria, psychosis, malaria, etc. So in Islamic law, in fact, it's not considered these diseases are considered as the diseases in the science of medicine, but the situation of destroying the power of appeal of a person, power of judgment of a person. So we should concentrate on the full Eda competence, and in fact, proxy, Hajj by proxy may be an alternative. And there is an increasing aging population all around the world. You know, dementia is considered as a disease of advanced age, and the number of the patients is increasing. This is not only related to the patients, but also the caregivers and the relatives. So at an advanced level, the dementia patients cannot handle their self-care, and they cannot feed themselves. And building on this fact, because of these diseases, if these people failed in fulfilling their obligations when they were healthy, then close relatives, kins, need to fulfill this obligation, or they need to make sure that this obligation is fulfilled in consideration by others. Thank you, Professor. Dr. Mehmet Onur, PhD, thank you. He talked about the Hajj obligation in case of mental illness.